innovative practice in tobacco control in India. And today's topic is People Movement for Tobacco-Free Villages Initiative. It is a unique success story from Mandya district of Karnataka, India. And presenter with this is Jill Thomas. She is Divisional Coordinator, Tobacco Control Program at Vital Strategies, India Services Private Limited. So you are all welcome to the show. And this webinar is being organized by the Strategic Institute for Public Health Education Research, RCTC PGI Chandigarh, and along with that, Eco India. So Dr. Sanchika is representing us on Eco India. So this is Dr. Sanchika. She's from Eco India. She's manager project at Eco India. So this is and I must welcome all the participants and welcome Jill Thomas, Divisional Coordinator, Tobacco Control Division, Vital Strategies, as I've already told you. And Dr. Sanchika Gupta, Manager Projects, is also warmly welcome. So Strategic Institute of Education and Research that was established in 2018 with the fundamental purpose of creating a special public health workforce and execute and monitor national health programs and public health initiatives for tackling emerging health challenges. We are working on all public health issues with a special focus on non-communicable diseases. And now actually we have completed more than 150 physical or virtual workshops. And this webinar series is based on the best practices being enlisted by RCTC PGI Chandigarh. And Resource Center Tobacco Control is visited by lakhs of people every day, actually. So you're all welcome to the show. So over to Jill Thomas. Thank you.
Yeah, thank you, sir.
Is this visible? Is PowerPoint visible?
Yes, sir. It's visible.
Okay, then you can go ahead. Just let me know when to change the slides.
Okay.
Is it all right?
Mm-hmm. Yeah, it's in a second slide. First.
Okay.
Yeah, okay. I'll start. Okay. Good afternoon, everyone. And thank you, Rakesh sir and Sipher, RCTC, and Eco India for giving me this opportunity to present our work done at district level. So, as you know, the topic for above presentation is People Movement for Tobacco-Free Village Initiative. So, today's presentation provide insight into the strategy we used, challenges we faced during this outcome, and this initiative can be replicated in other rural areas also, and it can serve as model for other districts and states to promote tobacco-free village and improve their public health. So, why it is so important? Why it is so important? Because as we see, tobacco prevalence is higher in rural areas than urban areas in Karnataka. And awareness about the adverse health effects of tobacco use is very low in these areas. And the lack of awareness leads to fewer attempts by the people to quit tobacco, and they are using more smokeless tobacco. As we see in the GATS 2 survey, okay, Global Adult Tobacco Survey 2, according to that survey, prevalence of Karnataka for the tobacco users is 22.8%. But in urban areas, we can see 18.5% they are using tobacco. But in rural area, it's almost 25.9%. Whereas if we compare smoking and smokeless, the similar thing. Like smoking is also 8.8% average, but higher in rural places is 6.7%. Whereas in urban areas is only less. Similarly, in smokeless tobacco. So smokeless tobacco in rural areas, we can see 18.4% of the people they are using this smokeless tobacco. So why tobacco-free village? Why it is so important? So tobacco-free village means there is no sale and consumption of tobacco products in the village. So no sale and no consumption. and it is informed decision of village heads to keep away its people from tobacco products. No, we can see that Abraham Lincoln once said, democracy is a rule of people for the people and by the people. तो यहाँ पे क्या होगा, एक विलेज लेवल में ही वो लोग कमिटी बनाएंगे एंड दे themselves form a committee and a government, और वो ही उधर वो लोग कंटिन्यू करेंगे. And what is the key criteria for selecting these tobacco free villages? So one criteria is small geography with less number of people, less number of population, less number of point of sale, that is tobacco vendors. Village which has taken many such initiatives before to upload public health as a key priority. And active and well motivated village panchayat president and members. And based on some analysis like tobacco products usage, consumption, we can continue this process. Next. So what is the intervention or response for this one? What we have done? So the intervention focused on making the Naguvinahalli village in Mandya district. So we selected Naguvinahalli village for this tobacco-free village initiative. And for implementing this thing, we sensitized village officials, conducted awareness campaigns, we have given cessation support, we mapped tobacco vendors, and also enforcement drives also conducted and involved the various stakeholders to achieve this goal. So what we have done, so step by step I'll explain. So initially on 8th March, before slides, the first, yeah. So on 8th March 2021, a district level coordination committee was conducted under the chairmanship of district commissioner or district magistrate to discuss making villages as tobacco free, considering the high number of non-communicable diseases reported in this Naguvinahalli village, like BP is high, sugar is high. So they have conducted one survey there. Under this survey, they identified 242 tobacco users in this particular village, and cessation support was given with the help of ICTC counselor because full-time counselor under NTCP was not available. So we took support from ICTC counselor and also oral health doctors under NOHP program, and counseling was started and given twice in a month. And we also conducted sensitization program with the panchayat administrator and panchayat officials by our district tobacco control cell from the Mandya districts, and they also sensitized about ill effects of tobacco consumption. Next slide. So after sensitization, District Tobacco Control Cell informed them about the order issued by RDPR department in the year 2014. And in that order, it is clearly mentioned to work, these people, PDOs should work on tobacco-free village work plan. So we focused this order, and we also informed the PDOs to work on tobacco-free village initiative. And on 16th March 2021, a rose campaign was conducted to raise among villagers about ill effects of tobacco consumption by involving school and college students who visited identified shops where tobacco vendors are there, and they handed over a red rose as a symbol of love and respect, along with some of the handouts explaining what is the use of this objective of this rose campaign, and sensitized tobacco sellers on ill effects of tobacco consumption and some of the quota provisions. And a resolution was submitted by the panchayat development officer, and they approved during DLCC meeting, and the Gram Sabha meeting was conducted and sensitized about the ill effects of tobacco consumption during that meeting. Next slide. So next what we have done on 27th March, almost 2021, a school awareness program was conducted along with the essay competition, and we distributed prizes to the winners. And the mapping of tobacco vendors was also conducted by the accredited ASHA workers. Meeting was conducted with the tobacco vendors in that village. And the outcome was that 99% of the vendors agreed to stop the sale of tobacco products. Village-wise meetings were also conducted by the District Tobacco Control Cell along with the panchayat members, and door-to-door campaign was also done along with ASHA workers and along with village leaders and public health centers. So on World No Tobacco Day, the previous one slide, yeah. So on 31st May, World No Tobacco Day was organized and villages were asked to take pledge on declaring their villages as tobacco-free village. Next slide. To sensitize them, some of the IEC posters on tobacco-free village were developed and distributed to in the panchayat, and rigorously court enforcement drives were also conducted twice in a month. In a picture, you can see some of the IEC materials we have developed, and the village members and ASHA workers, they went door to door and gave awareness to other villages. Next. To make a tobacco-free village, it is very much important. We should engage multi stakeholders from other department also. So what we have done, so some of the important stakeholders are there during this tobacco-free village initiatives. For example, RDPR, so State Rural Development and Panchayat Raj Department. So they supported the initiative by conducting meetings with panchayat members, requesting their support for tobacco-free village. And they also displayed no smoking boards in all the public places in that village. Education department is very much important. So education department, they supported by conducting awareness programs in schools and colleges, by providing some of the sensitization programs for the villagers. And of course, health department is also is a major part. So health department provided cessation support for we can see for the tobacco users, and also the milk federation is there. I have not mentioned here, but the milk federation, they also participated by spreading awareness through their milk goods. Tourism department is very much important because this Naguvinahalli village is a tourist place. So most of the tourists, they are visiting these villages. So tourism department, what they have done, they displayed boards at the entrance of the villages, emphasizing the importance of not to use any tobacco products in their villages. And also we sensitized Red Cross and NGOs. They have provided us additional support in conducting awareness campaigns and health camps. And the involvement of this multiple department and stakeholders help us to strengthen the implementation of this tobacco-free village initiative. And also, in addition to this, the involvement of local political leaders and NGO has helped us to give awareness, because we involve public political leaders also. They also came for this rose campaign. They also spoke about the ill effects of tobacco. Next slide. So is it possible to make tobacco-free village, this initiative? Yes, of course. The tobacco-free village initiative has been successfully integrated into community to the formation of Gram Sabha Samiti. So in the next slide, I will explain about how many members are there, what is their roles and responsibilities. So this committee is serve as a monitoring committee for this initiative. And this committee consists of representatives from different departments and sectors, and they have their each role, specific role, and they have their specific responsibility also. And this committee is chaired by Gram Panchayat President, and the committee is responsible for ensuring regular enforcement of the Kotpa and conducting some of the enforcement drives, awareness programs, and giving some of the technical support to these villagers. Next slide. So to sustain this initiative over time, regular monitoring and compliance check need to be conducted, and it will be done under District Tobacco Control Cell and along with ASHA workers. And the Gram Sabha committee also meets regularly to review this progress. So in this slide, you can see some of the members and what's their roles and responsibilities. For example, Gram Panchayat President, he will do the overall supervision of tobacco-free initiative and looking the sustainability of this initiative. Member of Gram Sabha Panchayat, he is conducting health awareness programs on ill effects of tobacco consumption and tobacco cessation services. What is the role of ASHA workers? To provide health awareness and conducting behavioral change communication with IC materials. And also headmasters and headmaster from government or primary schools, because they can supervise the sale of tobacco products to minors in and around their educational institution. And they also involved in conducting FOTPA enforcement drives along with other authorities from District Tobacco Control Cell. Next. As I told you, multi-stakeholders engagement is very much important. So one police sub-inspector or constable is also important for the regular enforcement drive, and he can also tackle this. He can also report this to District Tobacco Control Cell. And from the NTCP program, we have district consultant and social worker who is providing technical support to tobacco-free village initiative and facilitating regular monitoring and some of the meetings, enforcement, IC programs, training, and they are also doing the documentation. From the health department, one health assistant is very much important because to conduct regular camps and provide healthcare awareness programs to that villages. And from Anganwadi supervisor, women and child department, Anganwadi supervisor must be there to ensure complete compliance of FOTPA in Anganwadi, because in village also there is some Anganwadis we have seen. So that's the reason we included this department in this committee. And also the NGOs, because NGOs and other members, youth club, they are also creating public awareness to the villages. Next. So what's this transfer value? The tobacco-free village intervention has brought numerous benefits to these villagers. Firstly, it has raised awareness among the villagers about harmful effects of tobacco consumption, and this has resulted as improved health outcomes. As I mentioned earlier, NCD is seen more, BP sugar level is more in that villages, so it reduced, and it's also reduced healthcare cost also. Additionally, the intervention had led to the creation of clean and healthy environment in the village, and more attractive places like Nagvinahalli tourists, they visited more. And this initiative also provided the opportunity for the villagers to come together and to work on a common goal, that is for tobacco-free village goal. And lastly, the intervention has contributed to the larger goal, achieving Karnataka's aim, like tobacco-free generation, by reducing accessibility of the tobacco products, especially to minors. So by protecting our future generations. So what is the impact? What is the result of this tobacco-free campaign? So Nagvinahalli village in Mandya district, it covered 2,252 population from 635 households. Themselves they declared as tobacco-free village by passing their resolution on 22nd June 2022. So it took almost 1 year for the declaration. And they displayed tobacco-free village board at the prominent places. So I have displayed one board here. So you can see this board in front of that village. And during survey, we have noticed that 14 tobacco vendors were found. Uh, who are selling these tobacco products, but after that one they stopped this sale. Next. So this is the overall outcome of this tobacco-free village. So I have mentioned like baseline and post intervention. So as you seen in table, the number of tobacco vendors in the village reduced from 14 to 0 after this intervention, and there were no shops displaying any tobacco advertisement and any selling any tobacco products to minors. And the compliance with the quota regulation in public places increased from 20% to 100%. And in that village, we conducted 4 health camps, and 278 people participated in these health camps. So this gives overall the impact of tobacco-free village initiative. So what is the criteria for selecting this tobacco-free initiative and how we can declare? So already we have seen the criteria. So no sale or purchase of tobacco products inside the villages, and they should display the tobacco-free village board at the prominent places like near the main gate or boundary wall of the village. So this is one of the board displayed near their village, near the schools. They also displayed this welcome to Naguvinahalli village. Usage of tobacco products is not is prohibited in this area. And in another picture you can see they have collected cigarette and BD butts in that village so that they can completely declare their village as tobacco free and without any BD or cigarette butts. Next slide. So, and also, according to Code Section 5, no direct or indirect advertisement of tobacco or related products should be there. So we should ensure that one also. And we have kept a copy of Bodpa law manual, Bodpa book, and it has given to the village panchayat, and it should be available at all the time. Next. So these are the 2 women who worked for the tobacco-free village. One is PDO and one is a member of that panchayat. So both of them, they work rigorously for making this village as tobacco free. So the slogan has said, Naguvinahalli is all smiles with tobacco free tag. Next slide. So what is the challenges? Do we faced many challenges during this tobacco free initiative? Yes, of course, we have faced many challenges during this tobacco free initiative. One is resistance from tobacco vendors. So one of the major challenges was to sensitize tobacco vendors who were already selling tobacco products and convince them to switch to alternative work is a little bit difficult. To overcome this, our district tobacco control cell team, they had to engage extensive community mobilization efforts, including regular meetings with them, a discussion with the vendors, and providing them the alternative livelihood options. And the second one, difficulty in sensitizing the population. So another challenge was sensitize and to involve each person in the village. So team had to conduct several rounds of awareness campaigns, meetings and training programs for the villagers to raise their awareness about the harmful effects of tobacco and to benefit of a tobacco-free village. And one more difficulty we face like difficulties in follow-up and counseling because during survey we have noticed 242 tobacco users were there. So counseling and regular follow-up with the NRT was also challenging and it required a lot of time, energy and resources. So our team, they had to train and involve local ASHA workers and health assistant to provide counseling and do the follow-up for that tobacco users. And one more most important challenge is tourist control because Mandya district is famous for tourism and controlling tourists who use tobacco was a major challenge. So our team worked hard with these local authorities and tour operators to create awareness among tourists and for making these villages tobacco free. Next. So what is our conclusion and our recommendation? So the initiative aimed to make tobacco free by reducing the accessibility of the tobacco and sensitizing the villagers about harmful effects of tobacco use. And the implementation involved the formation of monitoring committee. We also involved various stakeholders and conducted regular compliance checks. And the initiative faced challenges such as controlling the sale of tobacco in border villages, involving every villager, sensitizing tobacco vendors, and providing follow-up counseling, giving NRT. However, this initiative was successful in making Nagvinahalli as tobacco-free village. Next. So these are the two pictures. Appreciation is given from State Tobacco Control Cell, Department of Health and Family Welfare. We welcomed we invited our District Tobacco Control Cell and the village person and PDOs for the state level workshop. We appreciated, our commissioner appreciated, and now we are focusing on giving some of the incentives to these villagers. Next. So finally, I should thank my State Tobacco Control Cell for giving this opportunity to present this work. And also the person who worked behind this thing is District Tobacco Control Cell, DHO, our District Surveillance Officer, other department from Home Department, RDPR, Commissioner, and also the Education Department and our DHO. Next. So thank you so much. I say not to use any tobacco, and this QR code is about Stop Tobacco app. But this app is only available for in Karnataka. You can use it if you are traveling to Karnataka for any to register any code violations. Thank you so much. Sir, you are not audible.
Thanks a lot, Jill Thomas. And you have done a commendable job. And I must say that it has been done very, very meticulously. And you have not taken a shorter route and carried out it very, systematically. And Dr. Rakesh Gupta is with us, Dr. Rana is with us, Dr. Ram Prasad is with us. So they'll be telling more about this. But I must say that you have done a commendable job and you have identified the tobacco users. I think that is the first thing that is to be done. And the tobacco cessation has also been administered to all those identified in the village. Then the Rose campaign was exceptional, I must say, that you have been able to motivate people not to use tobacco. Then there was a resolution by the Panchayat Development Officer. Then school awareness program, that is also very good initiative because the kids, they can tell their parents not to use tobacco. And it is important to make them aware about this. Then you did mapping of the point of sale. And the pledge was also delivered on 31st May. So Dr. Rakesh Gupta, he may not agree that the pledge has some value, but I must say that at least it creates awareness among the people who take pledge. And then you also did COTPA and that enforcement campaigns also. So that is also good. And you involved all the multi-sectoral partners. I mean, all the departments and everyone who is involved, including NGOs, who is involved in tobacco control. Then you also involved the local political leaders. So health department is definitely there. Then you also involve the dairy department, education department, tourism department, because it is a tourist place. So you had to involve the tourism department also. And you made it sure that it can be institutionalized and the intervention can be sustainable. So that is also important. So many of the people, many of the state nodal officer, district nodal officer thinking about it. Now they know how to go about it. That is really good. So it can be, it has got a translatory value and can be replicated anywhere. And you also talked about the challenges. So thanks a lot, Jill, for a wonderful presentation. So over to, I think we can ask Dr. Rana Singh. So what comments he has to make? Yeah.
Uh, Thank you, Dr. Gupta. Thank you, Jael. So you see, I think let's have comments from other colleagues. We have been working on smoke-free and tobacco-free village campaigns in many other states also. So I think it's good to have comments from colleagues. Then I will again provide
So
my thoughts.
I think we can hear comments from Dr. Rakesh Gupta from
Yeah.
ICMR.
Yes.
Thank you. Thank you for this opportunity. And I know it's not easy to work to make a village tobacco free. So best compliments and congratulations to your team, Jill. And there are a few points I think you must have done already, but I think presentation requires highlighting those. So like you said that divisional commissioner was the key person, as I understood. So it should be specified that way, because it's like having somebody whose name will work everywhere. So who was that person? Is this the divisional commissioner? Then my question is, if this was the divisional commissioner, what happened to the role of district collector and the CMHO? Those were not mentioned in a way. Is this program sustaining now till date? That should be added in the presentation. I think when you also say about the tobacco-free generation campaign, you also have to say, because it's a birthday restriction. So what was the birthday restriction which was accepted by the Gram Panchayat? Was this done or it was not done? When you say end game, now the commercial sale has stopped in the village. So if that has happened and has continued, I think that is definitely one big achievement, although at a small level, but I think that requires to be specified. And at places you have written as tobacco-free villages, whereas this is one village with over 2,200 people. So that correction requires to be made. So these are some of the things which I would have loved to see in the presentation. Otherwise, great presentation, keep it up. And what is the impact on the adjacent villages? Are you working in those? I think that also should be mentioned. So back to you.
Yes, sir.
Zeel, yeah.
Yeah. It's not a divisional commissioner, it's a district commissioner. So he's the one who is district magistrate in some other places called. So yeah, he's doing that one. And still sustainability is there. As we initially we told that 242 users were there. Now
correct me for one thing. District commissioner is district collector in
Yes.
Yeah. We call district commissioner. Yes.
Like in Punjab, we called deputy commissioner.
Deputy commissioner, yes.
Yes. So sustainability is there, sir. For the tobacco users, while during the baseline survey there were total 242 users who used tobacco, but now it reduced. Now only 30 users are there, and regular counseling and NRT is given in that particular taluk, Srirangapatana taluk, where our PSC is there. So twice in a week, our counselor will go there and they'll give the counseling and they'll provide this nicotine gums and patches. And also in between, from outside, some of the villages, tourist people, they came to this village and they used tobacco. But our team, they went there, they done the enforcement drives and they have found that thing. So committee is there, they are monitoring regularly. So sustainability still it's maintained. And also, this World No Tobacco Day also they have conducted awareness program in that village itself. Yes.
So thank you, Jill, and thank you, Dr. Rakesh Gupta. So as SNO Punjab, actually, we started this initiative, but I think after Himachal Pradesh. So we declared 300 villages as tobacco-free, but that was based only on the self-declaration. But it was not so methodical. So I think if we would have done now, we wouldn't have been able to make just two. We would have been able to make just 2 or 3 villages tobacco-free. So I must agree on that issue. So, Dr. Jael Thomas, you can introduce some of the people who are with you, some
Yes,
of the senior officials. Yeah.
yes, senior officials. And also I want to tell one thing, sir. Like after this village declaration, tobacco-free village declaration, 4 more villages also declared as tobacco-free in that Mandya districts. And 6 villages is on doing progress. So they are working on this tobacco-free village initiative. So I would thank our DSO, our district commissioner, our DSO, Dr. Sanjay sir, but he is not there in the Mandya district. He got transferred to other districts. So I thank him and also thank our district tobacco control cell. I think they joined here. Don't know. Our district consultant, our Timraju, and our social worker. They also helped a lot. They worked rigorously to make these villages tobacco free. So day and night, I can say in the evening also they went there. They have conducted some of the awareness program during evening time also, around 8 o'clock, 9 o'clock. So they have given their time and energy to make this villages tobacco free.
Okay, that
And
is great.
also, I thank our DHO. Currently, he is working as IEC officer. Deputy director in state level. So he's right now in state Arogya Sauda. So he's not working there. So I should thank him also. Making. And
Yes.
I should thank Rana sir for
Yeah.
giving us technical support.
So I
and,
thought you missed him actually. I thought.
so Rana sir, Amit sir, and whole my vital strategy team and our team also, Prabhakar, Navina, and Mahantish, who helped me to work along with this team to make tobacco privilege. Thank you so much.
So Dr. Ramprasad, he has raised his hand.
Yeah.
So let
Thank
us
you.
know what he wants to
Yeah,
say.
thank you, sir. Thank you so much for the opportunity. Thank you, Jael Thomas, man. Very nice to hear the insights and
you.
inputs from Mandya. We had a similar experience in Udupi about 2 years back. We also declared a particular village, a coastal village, as tobacco free. And we had a lot of support from the vendors. And since it was a coastal hamlet, we actually used even the religious and cultural spiritual organization like bhajan mandalis and all the elders to propagate this movement, and they voluntarily declared it as tobacco free. So that's a very nice initiative, and I hope more such villages follow the same line. I just had one query, madam, regarding this. This project was for the entire district of Mandya, right? Mandya city or Mandya district?
No, Mandya district, only that Naguinahalli village, not entire.
Only Naguinahalli village, right, ma'am?
Yes,
so now,
yes.
did you face any challenges when you're addressing farmers in particular? Because Mandya is the farming community, and farmers have their own resistance issues. So that's the reason I'm bringing it up. Agricultural and farmer-oriented issues. Yeah.
Yes. In this village, Naguinahalli, there is no tobacco farmers. In Mysore districts of Hunsur Taluk, we can see tobacco farmers. So that's one reason we have not faced any challenges from horticulture farmers.
So,
yeah.
Yeah, but farmers using tobacco, madam. Farmers using tobacco. What was your experience with that?
Yeah, initially they have some opposition was there, so they don't want to go to the PSC for counseling. So anyhow, our team they motivate them. So that's the reason now only 30 tobacco users are there. So that's one. Yes.
It's a very nice initiative. Really appreciate the effort. Thank you so much. Thanks.
Yeah, thank you.
So thank you, Dr. Ramprasad. So we have with us Dr. Aruna DS. So Dr. Aruna, you can just pose your question yourself after unmuting. She says that what were the actions taken for COTPA violation at baseline and switching from tobacco products to another substance? I think she's not with us now. So can you answer to these questions? What were the actions taken for COTPA violation at baseline and switching from tobacco products to another substance?
Yes. So COTPA violation, initially we have seen some of the violation there. So that's the reason we have conducted enforcement drives twice in a week there. So that enforcement drives were conducted. So now there is no violation. In between, one violation was seen. So our team went there and they have done FOTPA enforcement drives. And for second thing, switching from tobacco products to another substance. So now we are only focusing on tobacco counseling. So along with other team also, DMHP team, we are integrating to give some of the awareness related to drug substances, drug uses. So that's also going on. So we need to work along with them also.
So thank you. And there's a question from Dr. Rakesh Gupta, whether the new district commissioner is equally supportive? The
Yes.
new yeah.
Yes, equally supported. That's the reason we have already declared another four district villages as tobacco free, and 6 villages work is going on.
Okay, thank you. And he has also sent some personal comments just to make amendments in the PowerPoint. So as he has suggested, so that
Yes,
is
I'll do that.
that is good. Yeah.
Namaste.
Yes. So anyone can pose any question.
Hello.
Yeah. Who is it, please? Dr. Siddhi, do you have any queries? Dr. Siddhi Hatiwala. So anybody can ask questions. Just unmute yourself and just then ask questions. Dr. Sanchika, can we take a snapshot? If all you are all requested to please switch on your videos so that Dr. Sanchika can have a good snapshot. Have you taken the snapshots? Okay, thank you. Thank you, Dr. Sanchika. So anyone, if he or she has got any query, they can just unmute themselves and ask questions. So Dr. Rana, for your concluding remarks.
So thank you, Dr. Gupta. Thank you, Dr. Sanchika, Jael, Thomas. No, you see, if we look at history of tobacco control at village level in our country, so I can recall only once it was all after COTPA was enacted and we have National Tobacco Control Program. Maybe there are instances for which I am not aware. So it all started in 2000, I think 8 or 9. First, it was in Madhya Pradesh. We made a plan how we can go to the villages and convey this message to them also. So village health, sanitation and nutrition committee, they were the best way of reaching to the villages. So very efficiently, Madhya Pradesh Voluntary Health Association and state and district administration, they approached and planned to make villages smoke free. At that time, that concept was there because that was very beginning of tobacco control. So focus was to highlight on smoke free villages, and a criteria was developed that what is a smoke free village. I think 600 to 700 villages, they declared themselves as smoke free based on a criteria, very simple criteria. No one is smoking at a public place. There are boards displayed in the village. There are no smoking aids. There is no smoking smell at public places. So very simple criteria. So you see, that is something very, all these small things are very, very important. Thereafter, it was Himachal Pradesh, which really did a wonderful work. Wonderful work. In Himachal Pradesh, we have, I think, 3,700 panchayats. And I am happy to tell you that almost 3,300 panchayats, 3,300 panchayats, the panchayats, they declared themselves as smoke-free and gave on their letterhead that a committee has been constituted and the committee has inspected whole village. These are inspected, these are in committee members, and we did not find any smoking at public places, and there were no other violations of COTPA, and we declare our village as smoke-free. Just imagine 3,300 panchayats on their letterhead. अपने आप में in its it is a big achievement. So thereafter the movement started in many other states also. It was Karnataka, Uttar Pradesh, Kerala, in northeastern state it is Mizoram, Nagaland, where many such initiatives were taken up. Very recently, Uttarakhand, Punjab, Dr. Rakesh Gupta has already mentioned, he was mentioned 300, but I think later on that figure went to 700 something. They declared tobacco free. That was self-declaration. But in few declarations, that was based on a compliance assessment study conducted by the village itself, or maybe by some other civil society partners. So in that way, that movement has spread to rural areas. That is very important also. In our NTCP operational guidelines, there is a complete section on tobacco-free or tobacco control activities at a village level. So that is something which this is already a part of National Tobacco Control Program. This is not something which is now it is happening. It is only that now we are going to villages and seeing that tobacco control benefits, they reach our rural India also. So keeping seeing that success, so we worked with many states also, and states now they have launched in collaboration with the rural development. Earlier it was only health ministry, health department which was doing, but now a collaboration between many other departments is very important. So rural development and Panchayati Raj is most important department. So I am happy to tell you that now many states have launched their programs focused on villages. For example, तंबाकू मुक्त उत्तराखंड आओ गांव चले, tobacco free Uttarakhand, let's go to village, tobacco free Karnataka, आओ गांव चले. So movement is spreading in that way. तंबाकू मुक्त Uttar Pradesh, आओ गांव चले. So that is the program is being inaugurated. And so I think this is something which now needs to happen. And now, as far as criteria, how difficult it is, it all depends on the criteria which we follow. If we follow the criteria, for example, very simple criteria: no sale and purchase of tobacco products, no sale, no tobacco vendors in that village. That village has to be COTPA compliant. No advertisements, and there should be an IC plan. So it is not a difficult criteria. At the same time, if we say that there should not be any use of tobacco product, so you see, Jael Thomas mentioned that there was 200 something tobacco users. So I think that is something that should continue. How we can help them to quit also, but that challenge, difficulty, it all depends on the criteria which we develop. Right now, we do not have country level standard criteria which can be adopted. So even it's good, whatever the states are doing, whatever the criteria, robust criteria, they can follow for their state, for their district. So I think this is something, but definitely there is a need to have uniformity. Because the most difficult part is the current users in that village. So although Jael mentioned that there were 240 and now 32, and they were also supplying NRT and nicotine patches. And Dr. Gupta is also here, Dr. Rakesh Gupta ji from Rajasthan. And we all know cessation part, that whether it is how that has happened, and if it is in 1 year out of 242 and now it is only 32 and we all have quit. I think this is the biggest achievement. So I think someone must see, and I would also request Jael to once again to see that what is the current status. 242 at the baseline and 32 or 30 something tobacco user currently. It's a big achievement if people have really quit. So this is all, and once again, thank you, Jael. This is really something which has been done very systematically, and all states now they should, while they are working in cities, in towns, they should know step to rural India and see that our villages are smoke free, tobacco free, whatever can be done. So thank you very much, Dr. Gupta.
Thank you, Dr. Rana, for summarizing the whole issue. And I think now Ministry of Health is now planning to have a consultation on this tobacco-free villages. And I must say that Jael Thomas must be invited to that because she has done a practical field-level job. In addition to other people who have already worked on it, like Dr. Gopal Chauhan and Avdeshji, they have worked about this issue. So we have a guest from Iraq, Dr. Omar Hamad. So Dr. Hamad, do you have anything to say? Anything to add on the issue? Dr. Omar Hamad, are you with us?
Yeah.
Yes.
Yeah. So do you have any queries for her?
No, I don't have any issue.
Okay.
But I have some exception to this subject. In my country, we have a party which don't allow anyone who use tobacco.
Okay, that is great.
No, anybody in this participant of this party no can use tobacco or other cigarettes.
So thank you.
That's all.
Thank you, Dr. Omar.
Thank you.
Yeah, thank you.
Thank you.
So if anyone else has got any query or any questions, they can ask directly by just unmuting yourself, or we can just wind up the session. So thank you, Dr. Rana, Dr. Rakesh Gupta, Dr. Ramprasad for joining us. And special thanks to Dr. Jael Thomas, Sanchika Gupta, Siddhi Hathiwala, and Aruna, Dr. Aruna for joining, and Dr. Omar Hamad for joining. And I must also thank all the people from Karnataka, all the officials from Karnataka who have joined to listen to Jael Thomas. So thanks a lot. And my special thanks to all the participants. Actually, one time we had about 85 participants. So that shows that her work is recognized and they all want to learn from her. So thank you, Dr. Jael. Thank you. Thank you all.
Thank you, sir.
Thank you,
Thank you,
Ji.
everyone. Thank you, Rana.
Thank you.